Assalamu alaikum warahmatullahi wabarakatuh. Develop and test hypothesis. Develop hypothesis using descriptive epidemiology. इसमें पर्सन हो सकता है, प्लेस हो सकती है और टाइम हो सकता है. Clinical and laboratory findings. Test hypothesis using analytical epidemiology. Identify exposures significantly associated with illness. Analytic epidemiologic study designs, retrospective quad study or case control study. Retrospective or quad studies, ये जो है इसमें डिजीज़ अगर होने के बाद एनरोल किया जाता है. Enrolls everyone in a given population regardless of disease status. Technique of choice for acute break in well-defined populations. Church picnic. Retrospective or quad study. Directly measures risk of disease because the population of at risk is known. Outcome measures is relative risk. Risk in the exposed group divided by the risk in the unexposed group, relative risk, also known as the attack rate ratio. केस कंट्रोल स्टडी. ये स्टडी जो है डिजीज़ के साथ शुरू होती है और बैकवर्ड देखती है एट प्रायर एक्सपोजर्स पे. Useful when the population at risk is unknown. Group of people with disease and group of people without disease are enrolled. यानी इसमें वो लोग जो कि जिनको बीमारियां होती हैं उनको एनरोल किया जाता है या ऐसे लोगों को एनरोल किया जाता है जो कि बीमारी के बगैर होते हैं. एंड प्रायर एक्सपोजर्स आर असर्टन. Differences in exposures between groups indicates an association between exposure and disease. Case control study. The true size of exposed and unexposed groups is unknown. No denominator to calculate attack rate or relative risk. Outcome measure is odds ratio. The odds of developing disease based on exposure. Odds ratio can approximate relative risk when the cases are representative, when the controls are representative, when the disease being studied is rare. Study designs comparison. Quad. Illness occurs within a defined controlled populations. Compares rates of illness among those with risk factors and those without risk factors, relative risk. Case control. Illness does not occur in well-defined populations. Compares exposures among people with illness and those without illness, odds ratio. Steps of an outbreak investigation. Establish existence of an outbreak. Verify the diagnosis. Define a case. Identify additional cases. Perform descriptive epidemiology, develop and test hypothesis, reconsider hypothesis, perform additional studies if needed, implement control measures, communicate finding. Reconsider hypothesis. Square the hypothesis to clinical, laboratory and epidemiological factors if exposures histories for ill versus well are not significantly different, develop a new hypothesis. Perform additional studies, find more cases, define better the extent of the epidemic, evaluate new laboratory methods, evaluate case finding techniques, improve sensitivity and specificity of case findings, degree of exposure and dose response, environmental investigations. Implement control measures. Preventive exposure, prevent infections, prevent disease, prevent death. यानी कि कंट्रोल मेजर्स का मतलब ये है कि आप किस चीज़ से एक्सपोज हुए हैं, इन्फेक्शन हुआ है, उसको डिजीज़ हुई है और उसके बाद जो है वो डेथ हुई है। उसके कम्युनिकेट फाइंडिंग्स। आउटब्रेक इन्वेस्टिगेशन स्टाफ, किसको हमने करना है? आउटब्रेक इन्वेस्टिगेशन स्टाफ को। पब्लिक हेल्थ पर्सनल, गवर्नमेंट ऑफिशियल्स, हेल्थ केयर प्रोवाइडर्स, मीडिया एंड कम्युनिटी। Risk communications. It developed from the need to find more effective ways to communicate health risks. Goal is to provide information about expected type and magnitude of an outcome from a behavior or exposure. The purpose of the message is to empower decision making. Risk communication pitfalls. Mixed messages from multiple experts. Messages that are over reassuring, leaving myths, rumors, and doomsayers unchallenged or uncorrected. Public spokespersons who lack effect. Emergency risk communication principles. Stop trying to allay panic. Emphasize there is a process in place. Don't over pressure. Acknowledge uncertainty. Acknowledge people's fears. Express wishes. Give people things to do. Acknowledge the shared misery. Give anticipatory guidance. Address dreaded what if questions. Be a role model and ask more of people. Be regretful. Challenges in outbreak investigation. Data source, small numbers, specific corrections, publicity, reluctance to participate. Summary. Steps of an outbreak investigation are a guide, not to be used as a one size fits all model. Some steps may happen simultaneously. Clear and consistent communication is key. Thank you very much. अब हम शुरू करते हैं एपिडेमियोलॉजी को। एपिडेमियोलॉजी लिटरली मीनिंग द स्टडी ऑफ व्हाट इज अपॉन द पीपल is derived from Greek. Epi means upon, among. Demos meaning peoples. Logos means study. The distinction between epidemic and endemic was first drawn by Hippocrates to distinguish between diseases that are visited upon a population's epidemics from those that resides within a population's endemic. The term epidemic appears to have first been used to describe the study of epidemics in 1802 by the Spanish physicians Will Alba. Term epidemiology is now widely applied to cover the descriptions and causations of not only epidemic disease but of disease in general and even many health related conditions such as high blood pressures and obesity. Hippocrates examined the relationship between the occurrence of disease and environmental influence. Hippocrates believed sickness of the human body is caused by an imbalance of the four humors: air, fire, water, and earth. Thank you very much. Allah Hafiz.